My name is Gilberto Lopes. I'm a medical oncologist at the Sylvester Comprehensive Cancer Center at the University of Miami in Miami, Florida, and I had the privilege of presenting Keynote 42 at the ASCO annual meeting in the plenary session. Keynote 42 is a study that builds on what we have learned with a specific immunotherapy drug called pembrolizumab over the last few years. Pembrolizumab has been used in second line after platinum-based chemotherapy and has shown an improved survival in that situation. It has also been used as a single agent for patients who express PD-L1 at 50% and above, and it has also now more recently been used with combination with chemotherapy for patients with any level of expression. What we studied on Keynote 42 was to compare chemotherapy versus pembrolizumab for patients who express PD-L1 with a tumor proportion score of at least 1%. We randomized 637 patients to each arm, and these patients received either pembrolizumab 200 milligrams every 3 weeks or carboplatin with either paclitaxel or pemetrexed. Patients who received pembrolizumab had a better overall survival, which was the method, the statistical, the primary endpoint that we had for this trial. We tested sequentially in the subgroups with 50% and above, or expression of 20% and above, and expression of 1% and above, and we showed that all three groups overall survival was better with pembrolizumab as compared to chemotherapy. We also showed the toxicity was lesser with the immune checkpoint inhibitor. Patients who received pembrolizumab had about half of the rates of severe toxicity that patients who received chemotherapy had. In summary, this is a study that sets a new standard. Of course, it's not the only new standard because we also have combinations of chemotherapy with immune checkpoint inhibitors and combinations of immune checkpoint inhibitors that will be important for specific subgroups of patients. But this trial sets a new standard, that is that patients who express PD-L1 with at least a tumor proportion score of 1 and above do now have an option of receiving single-agent pembrolizumab and should not receive chemotherapy as a single agent, as a single modality, without the plans of adding immunotherapy at some point. For that, we're very thankful for the patients who participated and gave us their time to be part of this study.